I love the physical therapy field, and because I love it so much, it really bugs me when people have a bad experience at a physical therapy clinic because they didn't know the red flags along the way to know that this was probably not the best fit of a clinic for them. So today, I'm Dr. Christina, the Picky PT, and I want to talk to you about how to recognize red flags when you are interviewing PT practices and how to be picky about which PT practice you choose to work with. So red flags when you are in PT and you're feeling like you're not getting results, but you're not sure if this is how all PT goes or if this is, just not the right practice for you. You should look for things like, do they make sure and start and end your session with passive modalities such as heat or ice? In a lot of practices, they might have you do this for 10 minutes at the beginning, 10 minutes at the end. That's 20 minutes of your session that you're doing something that you could just do at home on your own. So that to me is going to be a red flag. If you go to a practice and they have you seeing a different therapist most sessions, because that's just whose schedule you ended up on, to me, working in practices like that, I found it very difficult to stay consistent with the patient's plan and not have it keep getting switched up by different therapists with different ideas. There's nothing wrong with bouncing ideas off of each other, but if a plan isn't consistent, how are you supposed to see progress? So to me, that's a red flag. If when you're at PT, you speak with the actual physical therapist for less than your whole session and you spend the majority of your session exercising on your own or exercising with a PT tech instead of a professional, that to me is a red flag because those techs are not trained in being able to make sure that you are doing that exercise correctly and using the right muscles as you do it. They're just trained in being able to read the chart that says you need to do 2 sets of this. So that's not professional care that you're getting at the time. Red flag. If you call up the PT clinic and you're looking to get an evaluation in and they can't get you in for more than 2 weeks, that's going to be a red flag in my book because I've worked with a lot of patients who told me they went to clinics and it took them a while to get in for the evaluation and then it took them a while to get in for follow-up visits too. If you're not able to get consistent care and seeing your therapist on a regular basis, then you're not going to be able to make the kind of progress that you could seeing a professional and checking in on a regular basis. If you go to a PT clinic and they have you doing the same exercises as other people around you and not personalized ones made for you and discussing with you why they chose those specific exercises for you, to me, that's a red flag. It's very easy to just do the same exercises for every knee patient or every shoulder patient, but is that really what you need in order to achieve the results that you want to achieve? I don't think so. Lastly, if you go to a PT clinic and your PT spends the majority of your session typing on their computer because they're trying to catch up on their notes, to me, that's a red flag. It's not the PT's fault, it's the model that is the problem because they are so overwhelmed with paperwork and with seeing multiple patients at the same time that they have to be typing notes during your session to keep up. That is time of your session that's being wasted and not being used to its full advantage. So if you are double booked, triple booked, and your therapist is having to stay on the computer typing their notes while they're working with you, that to me is going to be a red flag, and you might want to consider looking into other practices to get better care.